So, Patient Source as a company, we're a very young company, founded in 2012, co-founded by Dr. Michael Brooks and Dr. Philip Ashworth. There's some links on our website detailing the reasons that drove Mike to step out of mainstream clinical practice and fill out of academia. But suffice to say, there were near patient misses, actual patient harm, and a final catastrophic incident. And it's a foundation like that of better patient care that drives through the company to this present day. I was quite broadly experienced in EPR implementation. I took one of the big major nationals across the county of Dorset at Dorset Healthcare, and I saw the good, the bad and the ugly with quite a fixed system. There were benefits to the front line, but there were also a lot of restrictions. So when I was in my role at Trustmark as Director of Healthcare Strategy, I was asked to take an assessment of Patient Source. Were they the sort of company that Trustmark would like to bring into its portfolio of license reselling? When I spoke to Mike, I was completely blown away by the backstory, to the extent that I stood up the entire Trustmark senior management team, really put my neck on the chopping block, and invited Mike and Phil in. It was the first time I'd ever met them. So I sat there, quite tentatively as they relayed their story, explained their solution, and they captured the entire room. And this was repeated time and time again as we went up and down the country together for the next 6 months, talking to medical directors, very senior medical professionals and frontline staff. And you'd quite often walk into the room and there'd be quite a frosty atmosphere, to be honest. A medical director thinking, closed body language, oh my goodness, another electronic patient record solution. They don't bring an awful lot of value to me. They slow me and my teams down. And we'd nearly always walk out the room with them on the edge of their seat saying, this is exactly how I would have designed a system if I could compute a program. And that's the beauty of Patient Source. It's one of our key USPs, in that Dr. Michael Brooks, as a still practicing clinician, so a week a month we lose him, he turns his body clock completely around and works a week of nights at the James Paget A&E department, running that department. Then he comes back to us. We have a slightly zombified state with Mike as he slowly comes back to day hours. But then he regales us with stories of where he's saved people's lives as his alternative job to Patient Source. So the benefits are obvious. It keeps Mike at the very forefront of health and care development, and he brings all of that experience back into the system.